For the otolaryngologic physical examination, you need gloves, head mirror, nasal speculum, tongue depressor, and otoscope along with its apertures. Good day, I'm Erol Quiatchon and I will perform otolaryngologic physical examination. First, wear personal protective equipment. Magandang araw, Shalom Caballero. Ngayon, isasagawa ko ang ilang eksaminasyon sa iyong ilong of rhinoscopy, bibig o oral cavity examination, sa tenga o otoscopy, at panghuli sa leeg o neck examination. Pakipaalam lamang sa akin kung may pananakit na nararamdaman habang sinasagawa ang mga naturang eksaminasyon. Simulan na natin. Head mirror. Head mirror should be worn over the physician's eye of choice with the same side as the light source. While both eyes are open, the wearer should be able to read words in focus and maintain the binocular vision. The patient should be sitting straight. The physician should place the head mirror in the right position to produce the acceptable reflective luminescence. The physician and the patient should place their legs side by side with both feet on the floor for more comfortable position for examination. Anterior rhinoscopy. First, adjust the head mirror to the desirable position. Second, position the patient properly for better visualization of the nasal cavity. Third, palpate the nasal septum and check the cartilage that composes it for possible deviation. Fourth, make sure the patient is looking up. Then place your index finger into the tip of the nose while inserting and manipulating the nasal speculum to avoid injury for sudden movement of the patient. Then, slowly close the nasal speculum before removing. In anterior rhinoscopy, you will visualize the nasal septum like the skin for possible perforations, septal deviation, or hematoma, and superficial vessel or potential bleeding sites. Also, you can visualize the actual entire nasal cavity like the inferior turbinate, which is the most common, and middle turbinate, which is the less common. Check for possible edematous and inflamed mucosa or protruding polyps and foreign body. Oral cavity examination. First, palpate the temporomandibular joint and check for its movement by instructing the patient to open and close his or her jaw for several times. Then, locate the salivary glands for possible palpable pathology. After that, palpate the upper and the lower lips. Second, in inspecting the gingiva, use thumb and index finger slightly retract the upper lips and the lower lips to expose the gingiva. Third, proper illumination is fundamental for intraoral examination. Instruct the patient to depress and say ah to visualize the posterior oropharynx. Fourth, using the wooden tongue blade that's placed on the anterior two-thirds of the tongue, an adequate light source, inspect the tongue and also the buccal folds. Don't forget to check the entirety of the mouth and possible, check the orifice of the salivary glands. For normal findings of the oral cavity, lips, gums, oral mucosa, soft palate, uvula, tongue, and tonsils should appear symmetric, moist, pinkish in color, and normal in size, while the teeth should be clean and free from any decays, while the hard palate should appear pale pinkish in color. Otoscopy. In examining the ear, first, check the external ear, or also known as pinna or oracle. Palpate the areas of the pinna, check the symmetry, size, and shape. Also push the tragus inward to check for any tenderness. Second, tilt the head to opposite direction to properly visualize the mastoid process. and palpate for any lump and tenderness, and do this to both sides. In examining the inner ear, use otoscope and the appropriate aperture. Tilt the head to the opposite side, then pull the pinna upward, backward, and outward direction before inserting the otoscope. Extend the inner finger, then rest it in the tragus to prevent any injury if the patient suddenly moves. Slowly insert the otoscope and manipulate to visualize the tympanic membrane. Note for any pathological condition in the external acoustic meatus and the canal. In the normal findings of otoscopy, you can see some hair, often with yellow to brown cerumen of the auditory canal. The tympanic membrane will appear pinkish gray in color, translucent, and in neutral position. Malleus lies in the oblique fashion behind the upper part of the eardrum. The surface of the tympanic membrane is mobile in Valsalva and Toynbee maneuvers. Neck examination. In neck examination, posterior approach, you need to palpate the 6 levels of lymph nodes of the neck, starting from the anterior area of the neck, the level 1, which is the submental and the submandibular area, and note for the submandibular salivary glands. Next is the level 2, which is the upper jugular area, followed by the level 3, the middle third of the jugular area, moving on to the level 4, which is the lower jugular. Palpate the posterior angle of the neck, which is the level 5, then palpate the central area of the neck, which is the level 6. In examination of the thyroid, instruct the patient to swallow to feel if there is any lump that is located at the gland. Don't forget to palpate the pre and posterior auricular for any palpable lymph nodes. In normal neck findings, neck should appear symmetrical. No asymmetrical muscle should be palpated. No inflamed lymph node or also known as lymphadenopathy in any areas of the anterior, posterior angle and into the thyroid gland itself. Also, symmetrical swallowing and movement should be adequate. Adam's apple is more pronounced in males. There should be no odinophagia and dysphagia while performing the examination.